The purpose of this teaching video is to discuss proliferative diabetic retinopathy. Diabetic retinopathy is a big word that means that the inside of the eye, the lining of the eye called the retina, is showing signs of having diabetes for enough years. Contributing influences are the elevation of the blood sugar and sometimes elevation of blood pressure and cholesterol. When all these things have been present long enough, the blood vessels inside the retina begin to show changes. Normally they don't leak and bleed, but in diabetic retinopathy they do. And initially they just show little outpouchings of the capillaries called microaneurysms. A little bit later then there's some leakage of fluid into the substance of the tissue so that the retina becomes swollen like a sponge. And then in the more advanced stages the patient grows sprouts of abnormal blood vessels. These grow out of the natural eye vessels that grow into this jelly that fills the eye called the vitreous humor, and they're fragile and they tend to break and bleed. When the eye moves and the jelly shakes, these abnormal sprouts of vessels are shorn off and you have bleeding into the vitreous, which causes the patient to see spots, specks or streamers, and then these can spread out and obscure vision. So the typical history for a patient is to call in and say, I've had diabetes for 10 or 15 years, and my control has been less than optimal, and all of a sudden I began to have spots and floaters. I was just watching TV. It can happen at any time. And the doctor will dilate the patient's pupil, look through the into the eye with the headset with the lens held in the hand, and look for bleeding in this jelly and abnormal sprouts growing out of the blood vessels that are present in the retina. The treatment for proliferative diabetic retinopathy is to apply laser treatment to the retina. This causes the chemicals that cause these sprouts to grow to regress, and sometimes injections of medications such as bevacizumab, brand name Avastin, or ranibizumab, brand name Lucentis, into the eye causes these blood vessels to regress. The injectional therapies, however, are temporary, whereas the laser treatment has long-lasting effects. Patients with diabetes need to have annual screening exams to detect these things before bleeding occurs, but with appropriate monitoring and treatment, even these complications can be taken care of, and vision can be restored in patients who've lost it, and visual loss can be prevented in those who haven't lost vision. If you have any questions, please consult the pamphlet on proliferative diabetic retinopathy in the information document part of the website.